Welcome to Answer Plastic Surgery. In today's world, where video calls are a part of everyday life, many people have become more aware of the natural signs of aging on their face. In this video, we follow a one-on-one consultation with a patient who's ready to address several facial concerns, including under-eye wrinkles, sagging brows, jowls, and a wrinkled neck. She shares how these issues are especially noticeable on camera and how they affect her confidence in professional settings. Wanting to appear more refreshed and confident, she's decided to explore her options.
The different procedures that I'm interested in speaking to the doctor about is my wrinkles that are under my lower eyes, also maybe my brows, and then at my age, I have jowls and kind of a wrinkly neck. So I would like to address the whole thing. In today's world and being on Zoom with very, saggy skin and wrinkles, they're pronounced on camera. And in my profession, I'm expected to look professional. I find that during my meetings, I spend a lot of time like this. And I don't think that's a good way to be. So I decided to address it.
During the consultation, the clinic assistant explains that the treatment plan won't just lift the skin, but will also involve lifting the deeper SMAS layer, the muscle layer under the skin, to ensure longer-lasting and more natural results. The plan includes tightening the neck muscles, removing excess fat with gentle liposuction, excising loose skin, and even lifting the platysma muscle for a balanced neck contour. They also discuss how certain lines, like smile lines, may not disappear completely with lifting alone, and how fat grafting can be added to restore lost volume and soften deeper wrinkles. The assistant notes that since the patient doesn't have much fat in the jowl area, only minimal liposuction will be performed to avoid any risk of nerve damage and to preserve natural facial movement. This consultation highlights the importance of a personalized approach, where each detail is carefully considered to achieve safe, effective, and beautiful results. Before we continue, please visit answerplasticsurgery.com for more information.
So we're not lifting only the skin, but of course the SMAS layer, which is the deeper muscle layer. And this is going to allow the lifting to be long-lasting and for the results to be optimal in the long run. So we're going to tighten everything, then fix the soft tissues, and then excise the excess skin. So we're going to first do a very light liposuction to remove some of the excess fat, and then strengthen and gather the muscles back together on the neck. And then we'll do also a neck lift to lift up the platysma, which is the muscle layer in the neck, to make sure that everything is nice and balanced. So even if we tighten as much as we can, it doesn't mean that the lines right here, the smile lines, are going to disappear completely. That is not possible. And to improve that area further, we can do a fat grafting in addition to correct the wholeness a little bit. We usually harvest the fat from the thigh, where the fat is the most stable, and you'll have a better survival rate and therefore better results. So the surgeon is noting that you don't have much fat on the jowls, so we can do a very, very light liposuction just to smooth out the area a little bit, but we won't do it in excess, just because if we remove too much fat, we can cause also a bit of damage to the nerves, and that is going to cause your face or your muscles to move maybe in not such a natural manner. So we'll do it ever so slightly.
Through this detailed consultation, you'll get a closer look at how comprehensive facial rejuvenation is planned, combining surgical precision with artistic judgment to help each patient look and feel their best. Stay tuned for our next video as we walk you through our patient's procedure.